Hi, my name's Tracy. I'm a nursing student at Indiana State University. Healthcare education topic today is oral and pharyngeal cancer. Oral cancer is cancer that can be found in any of these areas of your mouth or any of these areas in your throat. If there's only one thing that you'd like to learn about oral and pharyngeal cancer, it's this. Early detection is imperative. These cancers are treatable, but only if they're caught early. It only takes your dentist about 90 seconds to look for oral cancer. Anyone can get oral or pharyngeal cancer, but there are certain things that put you in a higher risk group. Some of these risks you can do something about, such as using any kind of tobacco product will put you at a higher risk. Heavy use of alcohol, certain viruses such as HPV, not eating enough fruits and vegetables, and using marijuana. Unfortunately, there are some risk factors that you cannot do anything about, such as being older than 45, being in the Black race, or being of male gender. So what does oral and pharyngeal cancer look like? It can look like a sore on your lip or mouth that does not want to heal. It can be a lump or thickening of skin on the lips, gums, or in the mouth, a white patch or red patch on the gums, tongue, or lining of the mouth, bleeding, pain, or numbness in the lip or mouth, a change in your voice, loose teeth or dentures that no longer fit very well, trouble chewing or trouble swallowing or trouble moving the tongue or your jaw, swelling of the jaw, or a sore throat or feeling that there's something caught in your throat. Unfortunately, lip and oral cavity cancer may not have any symptoms at all, but it can be found during a regular dental exam. Oral and pharyngeal cancers only make up about 3% of all cancers in the United States. 90% of those are carcinomas, which is an uncontrolled growth of cells. The treatment options are surgery and radiation or a combination of both, but treatment is usually only successful if it's found in an earlier stage and has not begun to spread too much. The cancer can spread to surrounding tissues, it can spread through the lymph system, and it can spread through the blood vessels to other areas of the body. Once lip, oral, or throat cancer has been diagnosed, tests are done to find out if the cancer cells have spread within the lip and oral cavity to other parts of the body. Cancer may spread from where it began to other places. These stages are used for lip and oral cavity cancer. Stage 0 means that abnormal cells that may have the potential to become cancer have been found. Stage 2 means that the tumor is 2 centimeters or smaller and the deepest point of the tumor is about 5 millimeters. Or it's larger than 2 centimeters but not larger than 4 centimeters, and the deepest point of the tumor is 10 millimeters or less. A stage 3 tumor means that the tumor is larger than 2 centimeters, but it's not larger than 4 centimeters, and the deepest point of the tumor is greater than 10 millimeters. Or it can also mean that the tumor is larger than 4 centimeters, and the deepest point of the tumor is 10 millimeters or less. It can also mean that it is spread to at least one lymph node that is 3 centimeters or smaller and is on the same side of the neck as the primary tumor. Stage 4 tumor means that it is larger than 4 centimeters, deeper than 10 millimeters, and it has spread to multiple areas. Again, I'd like to state that early detection is very, very important with oral and pharyngeal cancers. Your dentist should be checking for this at regular visits, and it only takes about 90 seconds. The exam should check your lips and oral cavity for any abnormal areas. They should feel the entire inside of your mouth with a finger and examine the oral cavity with a small long-handled mirror and light. They should check the inside of the cheeks and lips, the gums, the roof and the floor of your mouth, and they should look at the top, the bottom, and each side of your tongue. Your neck will be felt for any swollen lymph nodes, and they should take a history of your health habits, past illnesses, medical and dental treatments. Healthy People 3030 has a goal to increase the number of people where oral and pharyngeal cancers were detected at the earliest stage. Their latest data set was from 2016, and it suggested that only 29.5% of oral and pharyngeal cancers were caught at the early stage. They would like to increase this to 34.2 by the year 2030. I think we should increase that to a much higher number. Thank you very much for listening to this presentation. If you would like to learn more about oral and pharyngeal cancers, you can look at the Healthy People 2030 website at health.gov. You can also look up the National Cancer Institute at nih.gov. Thank you for listening to this presentation.